Center. He has in his accolades special awards and achievements like Dynamic Indian and the Millennium by KG Foundation, Gynec Excellence Award by Foxy in 2020, Gynec Commendable Editor in Chief by IESRF in 2021, Icon of the Gynecology in World 2024. And NBE recognized DNB diploma, 2 seats up to 2027 he has in his hospitals. So total of 53 residents have passed from his course. 4 are doing residency. Narchi, that is recognized DGO, DCH, DRCH, DFW, and Foxy recognized ART, IUI, IVF, ICSI, and USG training 2D, 3D, 4D color Doppler. So the young generation are needed to know about this thing so they can take an advantage of this thing. He has also the ICOG fellowship in reproductive medicine and laparoscopy, 2 seat each. Reproductive fellow pass and 2 endoscopy fellowship doing at present. His own publications are 8 books by JP Publications, 3 chapters in postgraduate series by BI Publication, 1 chapter of DUB by Elsevier Publication, total of 66, 51 papers in IJOGR and 5 papers in IJBCP. The paper in IJMSPH, 2 paper in IJRCOG. So 762 presentation as faculty in conference. We are very lucky to have you, sir, over here, and the mic is now in your hands.
Thank you. Thank you, Baroda, for giving the opportunity again and again. Thank you, Sushma Madam. Thank you, Pramukh Madam. She might have gone for okay. Thank you. You can scan these 2 QR codes. This is of my orchid, in which you can see 118 research work, and this is for YouTube. There are all educational videos are there in YouTube. Welcome to Baroda. The moment child is born, mother is born. She is there, mother is something new. If somebody says what is the age of my mother, I can say she is the same age of mine. She was there, but she became mother after she delivered me. Am I right, madam? With the blessings of mother and with the blessings of happy Women's Day yesterday, madam, it is 1,000 days. It is 1,000 days of woman life, and then you can multiply it, because without Nari Shakti, no male can born. So this is a Nari Shakti, and we have to salute Nari Shakti because she has got 9 different swarups. Male has got only 1 swarup. And second thing, she can wear everything that male is wearing. Even our dhoti has been taken as a plazo, but we cannot wear usual anything what they are wearing. But today I have taken the advantage, the scarf become my tie. So you can also manipulate the things. So 3 book written by us is recommended in Royal College. Everything is active. So now we have got active management of labor, likewise active management of pregnancy also. Atlas of Fetal Echocardiography and Technique of IVF Bed Easy has gone for 2nd edition. And those who are youngsters, those who want to publish their works, they can contact me, because this is a Scopus recognized journal, IGOGR, and this is international journal in which I am working as a editor-in-chief. Last year in Asia, I got opportunity to interview Professor Herman Tourne. It is available on YouTube, and it is a very prestigious moment for me, because in front of 12,000 people I am interviewing Professor Herman Tourne over there. Holistic care, and thanks Baroda. Today I had visited Bochasan again, Jai Swaminarayan. So holistic care has to start from preconceptional stage. કુવામાં હશે તો અવાડામાં આવશે. પાયો સ્ટ્રોંગ હશે તો બિલ્ડિંગ સ્ટ્રોંગ બનશે. બધા પુરુષો અમે કહીએ તાકાત હોય તો આવ, તારી મેં સવા શેર સૂંઠ ખાધી હોય. Why it is સવા શેર સૂંઠ? It is a preconceptional medicine. Ginger, everybody talks about ginger. Ginger has got so many minerals are there. તો જેણે સવા શેર સૂંઠ નથી ખાધી એણે પ્રેગ્ના કેર ખાધી. Okay, so in ancient time, we all know that Jhansi Ki Rani, everybody is warrior. Here at present our women are eating, madam has already told, phaki, tamaku, gutka. At that time they are doing wrestling, running, casting darts. They have got fruits they conceived during, they become strong, healthy mind, healthy body. Every woman, and that time in our Rishi's era, every woman has to learn everything, and they are part of war also. Recently, I had seen picture Battalion 6888. They are all are Negroes women. They are working for American Army in World War II, and they are given the job to deliver just letter. But how many letters? 100 million letters are there. They have not reached to the particular person, and to know how about your family, you have to give them the right things. That book is nominated for Oscar also. That movie is also nominated for Oscar. The Negroes Woman Army. They have given the work of just giving the letter. It is a simple one, but they have to take 6 months to deliver one letter to the particular person. Because today they are in Michigan, yesterday they are in Europe. So it is very difficult to catch where they have to send the letter. But they are done by woman army. So don't underestimate the power of woman. Or a simple woman. So in ancient times, since they have to do all these things. But you see, the situation in India from 2015 to 2019, you must be surprised that this much pregnancy, 2 crore 1 lakh 5,000 pregnancy are unintended. Why? I had seen so many youngsters. Don't underestimate the power, because that of lack of knowledge of contraception and more of knowledge of emergency contraception. We have not seen that much young population become pregnant. If these all are unintended pregnancy, more than 16 lakh 6,600 pregnancy are ended in abortions. All are unintended. They become in abortions. एक सुवावड़ અને 7 का सुवावड़ આવું સુયાણી અમને કહેતી. Now imagine the woman wants to become her first pregnancy before she might have undergone 1 or 2 abortions. What about her health? We don't know. So that is because of unintended abortion and unintended pregnancy. 4 out of 10 women. 4 out of 10 women reported that pregnancy are unplanned. Second, prenatal deaths 50% higher amongst the baby born to adolescent mother. More and more adolescent pregnancies are there. I had seen why government has stopped doing hysterectomy in these markets. 23, 24 year female. They don't want tubal ligation. They want removal of uterus. Na rahega baaj, na bajegi baas. I had seen 13 para also. And by mistake I had asked, what is your last menstrual period? She told, on the day I got married. And I had never seen which type of menstruation is there. कैसे color का होता है, because he is 13 para. So imagine that much of situation is there. They married early, they produced child, and they want to have their own cricket team with 11 players and 2 umpires. So correctable causes like maternal malnutrition and deficiency anemia accounts for 20% of maternal mortality. Here everybody wants to talk regarding the reducing the maternal mortality, reducing the neonatal mortality. How you can prevent? You have to build up that lady pre-conception. That's why there is a concept of 100 days. And it is not me saying, that is Time magazine has also published that how the first 9 months shapes the rest of your life. If you give them very good nutrition preconceptionally, then it becomes very good. We always ask the history. And so many times I have given the definition. What is the definition of history? The study of past in light of present to a good future. Every day we are taking history. Why? Because patient wants to get better. We are asking her past in the present and to give her better future. That is the definition of history. And I am proud that I have become PhD in history, and my study is already published, and that is on Surendranagar district. And second PhD I am doing in Gujarat University in ITM. So I become 3 times doctor, do. Then we have to ask for nutritional care. What is the nutritional care? What is the 1000 days of life that is crucial for health impact? 100 days holds great importance in child's life. The period of conception of the age of 2 years are the crucial for development of brain, body, mind and soul. These things has to be maintained by the body. Optimizing maternal nutrition prior to pregnancy, including micronutrients adequacy both preconceptionally and during pregnancy, that is crucial for her better life. How we have to count 1000 days? 270 days of pregnancy, 180 days of breastfeeding, 550 days of initial phase of child development. The nutrition that baby gets from his mother through the diet is an indispensable fluid that drives from its incredible transformation. પેટમાં સારો ખોરાક હશે જેનું અન્ન સારું એનું મન સારું એનું તન સારું અને એનું બચ્ચું સારું. In fact, there is a concept that if you have to take double fluid because you are getting pregnancy, not like that. You have to take adequate food, and Vinodvan is rightly said, adequate nutrition you have to take in your diet. The child suffers when mother's diet and health are impaired during the critical period of development. Poor maternal child health outcome, particularly poor birth outcomes, are linked to inadequate maternal nutrition during conception, during pregnancy, and after delivery. Still we have got said, how much you have to give iron and folic acid? Till pregnancy, till 6 years. How many of you are giving that iron supplementation or nutrients post delivery? Thank you. Now you don't have to worry. Everybody is right. So what are the role of micronutrients? In first trimester we all know, Vinodvan has rightly mentioned folic acid, B1, B6. And we have to thank Professor S. Suresh, who has given the concept of engagement field. When she gets engaged, give her 5 milligram of folic acid daily or 400 microgram of folate daily. That will build her folic acid, and this is the only way we can prevent neural tube defects. Otherwise, neural tube defects, we all know the deficiency. And thank you, Mayor Vipat. I witnessed that conference in Mumbai of Spina Bifida Foundation. And within 6 months, I am going to Brazil for getting training to suture the spina bifida laparoscopically. Dr. Manish has already given me invitation. Just they are waiting for 3-4 cases, and then we will do this surgery in my town also, because this is not difficult surgery. We are doing with 3 instruments. All the protocols are set. In Brazil they are doing by laparoscopy. In France they are doing open surgery of spina bifida in utero. What is the advantage? I will tell you, it is not 100% cure surgery. But when patient borns, there is no spina bifida. But the neural development has got its effect. They might have bladder and bowel discomfort, but they can move. That gait is not proper as we are walking because of the neural deficiency, but they can walk. They can maintain their all the daily routines. And in Mumbai, like Leelavati, we are doing this surgery free of cost. In Rajkot, we have started Spina Bifida Foundation with Dr. Sithapara and Dr. Moda, and they are doing all this surgery free of cost. But this surgery now we are doing post delivery. But if you do this surgery in utero, the patient born has got no scar on the spine. Simple 3 or 4 stitch, you have to just distrap and take the stitch. And nowadays there is this artificial skin is also available. Just you have to put over there, it will heal by itself. So there is so much of advantage in spina bifida.
Sir, other than no scar, is there any other advantage of in utero surgery?
There is advantage, madam, because the growth. Why there is no growth? Because there is no apposition of the neural ligament. They are spared one. If you suture it, they become near. And now they are growing. There are all the chances that all the defect of spina bifida that what we are watching afterwards, post delivery, and then we are suturing it. At that time there is no development. Because at the 18 to 20 week or 20 to 24 week, if you do the surgery, there are 3-4 months, then neural gaps to get regenerated. Because there is regeneration. This is all molding occurring up to the 9 months of pregnancy. So they have difficulty in living, not as they are living with a normal person, but they can live little bit better life than those who are on a wheelchair. And best results are there if spina bifida and limbs are moving. If you see the baby of spina bifida and both limbs are moving in the utero, then you get the best results. Only difficulty is that little bit bladder and bowel discomfort, and for that they are also get nerve enhancement surgery They are putting electrodes over there, so they will get sensation and they have good picture. So there are lots of advantage they are doing, and this is the only thing these people are working hard at America, Brazil, and France. America, they don't give training. In Brazil, they are ready to give training because the country like us, and they will train us free of cost. Only we have to go at their place, and then we have to do surgery. Those who want to accompany as a laparoscopic surgeon, then they come. It is very good because Dr. Manish is also coming with me. No, it is not necessary. It is up to you. It is up to you what you want to do. But they are teaching us free. And Dr. Manjari Somsekar is from Bangalore. She is also coming with me, Dr. Sita Parajda. So we are going in a 4 group of people. So everybody will train in that. One pediatric, two pediatric surgeons are there. I am gynecologist. Then we can talk with this mayor people, and they are ready to do this work. I told them that they will open center in Gujarat also. People are ready to do it. They want to fund it. And we have got lots of spina bifida patients. Rather than going there for termination, we better to give them this type of surgery option. Ultimately, what words come to which doors will open? She will abort it. That we have to explain in every surgery. Even after 24 years of laparoscopic surgery, still I am taking consent of open surgery. In 1% case, I have to do open. So in this condition also, we have to say that in 1 or 5% patient, we have to go for abortion. There are chances that you can go for abortion. But now things are very much planned that we can do this open surgery also. We can fill renal lactate, we can suture it, and patients are fine. And there are specific management post-surgery also that we want to go in and learn them. Which are the topologies they are giving to know, and that we can also use in our preterm labor programs. Rather than etosipan, they are using so many things. So things are there, and they arrange 3 days conference in Mumbai, and these people had already sent me because I want to learn them. And these all people, France, Brazil, America, they are ready to give you training. Just you have to come. Okay. अच्छा, आप पे तो कोई सिगरेट पीती नहीं? Okay, sorry for that. So again, spina bifida, folic acid, B1, B6. But what you have to require during conception and implantation, this is utmost important. B6, vitamin D, E and folic acid, copper, iron, selenium and zinc. Now you see zinc, nowadays nobody is giving, but zinc has got utmost important in every corner of pre-conception, during conception, post-conception and lactation. So you give the preparation which has got higher in zinc, copper, selenium, vitamin D3, vitamin E. So all these 17 nutrients that is required for pregnancy supplementation during this 1000 days you have to give. So what first 1000 days? This is recommended by WHO, UNICEF, our ICMR. This all are saying that we have to give this foundation for lifelong health. Why we are discussing that? New thing I had heard in recent times, fetal origin of adult disease or adult disease of childhood origin. I am 55 and my 3 classmates has to undergo bypass. Before 1 week also one classmate has gone bypass. Very thin, everything is fine, but because her mother might not have taken the enough amount of nutrients that is giving for her good cardiac outcome. So poor diet during pregnancy, there are adverse pregnancy outcomes and increased child susceptibility to cardiometabolic disease in later in life. So those child who are deprived of, those mother who are deprived of nutrition during pregnancy, they are giving this disease to their child. And this makes a new era for all those diseased children can sue their mother that why you had not taken enough nutrients, that's why I am suffering from this disease. I am suffering from this disease because you had not taken macronutrients during your pregnancy time, so now I have got heart disease. And this can happen in near future. I had seen the kids who were telling that father, I had given you application that why you give me birth in your family. અરજી આપી તે મેં તમારા ઘરમાં મન પેદા કરો. હા મેડમ, આ છોકરાઓ આજકાલના એપ્લિકેશન ભાઈ તો ભૂલ થઈ ગઈ કાંઈ. So children can sue their mother for not taking enough nutrients. And this is new concept of fetal origin of adult disease or adult disease of childhood origin. So it's time, first time, Susma madam, in your times, two things are there. Vanda madam is already told, iron and folic acid. Pregnancy means iron and folic acid. In government what we are writing? BCCA FEFA. BCCA FEFA. B complex, vitamin C, iron and folic. BCCA FEFA 1B. Then second PCA. Same, कोई अजी तो कागज आया उन्होंने पेशेंट आया तो लगी BCCA FEFA. गवर्नमेंट में देख लगता था बता पास तो सरकार में किया BCCA FEFA. So now we have to think beyond iron and folic acid supplements because multiple micronutrient deficiency with anemia was found 55% in pregnant women. Usually every trimester of pregnancy, all nutrients are increasing or decreasing. Significant difference observed in micronutrients level along with all these different type of pregnancy. If you see, ferritin we have to give first and second trimester high. Vitamin B12 first trimester is very much required. Zinc is also required in first trimester. But you see, copper is more required in second trimester. Selenium in first trimester. Iodine in second trimester. And rightly Manish said iodine impregnated bindi. So many people had started iodine, folic acid and iron wheat flour. That is fortified wheat flour is there. It is supplied by government to give them nutrition because this is the way you can increase the new micronutrients in your life. So while the importance of folic acid and iron are there, we have to see that vitamin B12, A, copper, aluminum, copper, zinc, not aluminum, aluminum causing toxicity. Selenium are equally vital for fetal development and maternal health. So what are the benefits? If we give preconceptionally, what are the benefits? Enhance the reproductive environment by restoring the optimal nutrient level, strengthening antioxidant deficiency system, improving oocyte and embryo quality, everybody agrees. But how this reducing the time of conception? You believe that it will reduce the time of conception if you give preconceptional medicine? Increasing clinical pregnancy rate, supplemented with micronutrients may be good strategy to adopt in healthy women trying to conceive and those with fertility problems. First trimester, give them folate, iron and vitamin D3. Second trimester, we all know there is increased cardiac output, increased hormonal level, insulin sensitivity. So give them folate, iron, omega-3 fatty acids. Omega-3 fatty acids, nowadays they have found vegetarian source also to get omega-3 fatty acids. Third trimester, we all know calcium, plasma volume increase, sleep might be disturbed. So to give them folate, iron, omega-3 and vitamin D3. And Manish has rightly mentioned, don't overdose the vitamin D3. Vitamin D3 has got very much importance preconceptionally and vitamin D3 has very good importance in IVF also. With good vitamin D3 control, you got very good folliculogenesis and optimum follicular development is there and then you will get very good embryo. But it should not be overdosed. Start with 2,000, 5,000 or 60,000, whatsoever you are comfortable. These all tablets are coming with vitamin D3. That is around 2,000. That is a daily requirement. But if you want to give them the supplement, you can give 60,000 but not more than 3 months and not daily. Ati sarvatra vyarjyate. Ati is not good. Anything in ati is not good. So in postpartum, you have to take very good care because she is breastfeeding. The caloric intake is also increased during first 2 3 months and 12 to 24 continuous breastfeeding is usually we are giving breastfeeding up to 6 months, but that 6 months she is taking care of that baby, so baby is also getting very good micronutrients. Mother is taking good calcium, iron and folic vitamin D3 that for 1,000 days they have to give. How many of you know the importance of choline? We all know that folic acid is very good for neural tube development. Choline has got very good activity of brain development. Choline has got cognitive development in the child. Second most important thing in neural tube defect, choline has got methional donor that helps in neural tube development during fetal time, and choline contributes to all cell membrane formation, methylation and lipid metabolism. How much choline is required? 450 microgram during pregnancy and 900 microgram during lactation. So this is another micronutrients has got its importance in the childhood life. if I am saying that this is good, it should be endorsed by WHO. So WHO and UNICEF has started this tablet. It is UNIMMAP, United Nations International Multiple Micronutrient Antenatal Preparation. So in one preparation you have got all the things: vitamin A 800, vitamin D 200, vitamin E, niacin, folic acid, vitamin B1, B6, B12, zinc, iron, selenium, copper and iodine. You see, these are the requirements given by them for the international people. Sorry. So now we are in India ICMR 2020 recommendation. We had added magnesium. We had added vitamin C 70 plus 50. So it is 85 milligram. Zinc, iron, selenium, vitamin B12, and we had also added nicotinamide plus 2.5, pantothenic acid, folic acid, vitamin D, K and B12. So these are the 17 vital nutrients that we have to give during prenatal and pregnant woman. So how it is supported by clinical study? If suppose I am saying that we have to give for 1000 days, there should be some evidence. And this evidence are given by the preconceptional MMF that improved female fertility. This study is carried out by Spiller in 2019. They had used preconceptional multiple micronutrient supplements that improved female fertility. First instance, they said that if you use these micronutrients before conception, there will be 66 and 62.3, no, almost 2.3% patient gets a higher number of confirmed pregnancy. Time to conception, as I already told, how it is increasing the time to conception, usual, it says it is 2 days prior. They have done the study that 3.8 menstrual cycle compared with those who are not getting the stress element, they have got 4 cycles to become pregnant. But very good benefits of this study that among the women with fertility treatment, MMN supplementation resulted in significantly high cumulative clinical pregnancy rate. If you give only folic acid, that is 39.7, but if you give folic acid with MMN, that is 67.6. And ongoing pregnancy rate is 60% compared to 25%. So it is not only increasing the pregnancy rate, decreasing the concept cycle rate, and gives you very good pregnancy, continuation of pregnancy with cumulative pregnancy rate. Another very good study by Nayagel et al. It is published in 2021. They are studying on 1,599 offsprings. Those mother who has taken micronutrients, they have evaluated that if you have taken only micronutrients with iron and folic or micronutrients with iron and folic for the children of 6 to 7 years of age, women received weekly supplementation of folic acid 2800, 400 गुणिया 7, 7 चौक 28, weekly 2800 folic acid with 60 milligram of iron plus folic acid, iron and micronutrients from the baseline until conception, followed daily prenatal for 6 months. And what they found, what everybody wants, મારા બચ્ચાનો IQ જોરદાર હોવો જોઈએ. એમને આ સ્લાઇડ બતાવો. If you take this micronutrients, full scale IQ is higher, weekly memory index is higher, processing speed of their child is higher. So preconceptional supplementation with micronutrients improves certain domains of intellectual functioning at the age of 6 to 7 years with micronutrients compared with only folic acid. So antenatal micronutrient supplementation improves pregnancy outcome. They have done study on more than 140,000 women. Aim was to evaluate the benefit of oral MMN during pregnancy compared with fetal and infant healthy outcomes, or prospective randomized trial, controlling trial of multiple micronutrient supplementation with iron, folic acid and their outcome. What they had found, this slide is very cozy, but what they had found, what ultimately we want. You want to reduce the preterm birth, you want to reduce the small for gestational child, you want to reduce the low birth weight child. Everything has got moderate to high evidence. Even though there is decrease in the perinatal mortality, stillbirth and neonatal study, that all the Cochrane reviews, they said if you give folic acid with micronutrients, they will give you very good result. there are fewer babies, they born too small. There are fewer babies, those who have got FGR. FGR means fetal growth restriction, madam. Don't speak retardation. Now retardation word is out from terminology. Why? Because once you say retardation, they are thinking mental retardation, and I had seen people, those who have got terminated their child because doctor had said your child has got growth retardation. Now say it is a growth restriction. Change the terminology. Few births has occurred before 37 because sorry madam, this is the things people are latching. So don't use the word retardation, it is fetal growth restriction. It is not retardation. But whenever you say word retard, they are talking as a mental retardation. Postnatal, we had talked about prenatal, improves the fertility, improves good quality, reduction the time of conception, and cumulative pregnancy rate is very good. During pregnancy, we all know if you want to reduce the childhood origin of adult disease or adult disease of childhood origin, we have to give them nutrition. So postnatal, we have to bridge the nutritional gap. And this is study conducted by an Indian, our Delhi scientist in 2024. This study was conducted in 2024 by Manupati. Aim was to assess the impact of nutritional micronutrition with lactation mother up to the 6 month of postnatally. This is diet. I think Vinal madam, all female gynecologists also have to take part in it. Then now it become triad because they are also deficient in micronutrients. We can have a study of triad, mother, baby, and gynecologist herself. So there is a triad of that, and we can. What they had studied? They had done study on this 600 mother and infant. They had done all the blood samples on vitamin A, D, B12, ferritin, zinc, and folate. What they found? Mothers in international group, level of serum ferritin, retinol, folate, and vitamin D3 up to 6 months, all are at higher level. Supplementation was associated with higher mean SP of serum ferritin and vitamin A level in infants at the 6 months. Micronutrients during lactation improves maternal micronutrient status and slightly increased ferritin and vitamin E level in the infants up to 6 months of age. This is the meta-analysis of how these 17 micronutrients will affect in your nutrition. That is vitamin B12, folic acid, iodine, zinc, magnesium, vitamin D, B6 and C tablet. Preconception supplementation with MMN improves the certain domains of intellectual child up to the age of 6 to 7 months. So now if you taking up to 6 to 7 months, that is 1000 days, your child will not blame you that you have not taken proper nutrition. Maternal micronutrients are associated with greater gestational weight gain. Those who are not taking, they have got very good gestational weight gain. Fewer babies are born too small. Micronutrients intact during pregnancy and lactation improves micronutrient status mother up to and infant up to 6 months. Micronutrient status may affect the development of chronic disease of offspring. Micronutrient deficiency in pregnancy. Now we have to think beyond. Pregnancy is not BCCA-FEFA. It is not BCCA-FEFA. Micronutrient deficiency highly prevalent among the pregnant women. In 2025, Global Nutrition Target aims to reduce the low birth weight with improving maternal nutrition as the key of strategy. હવે એવું નથી ગમે બે અમારા બે ઇન્દિરા ગાંધીએ નોશન આપ્યું હતું અને મારા મમ્મી પપ્પા બે સમજ્યા ગમે બે અમારા બે તમે ચાર થઈ ગયા એમાં ક્યાં ચોખવટ કરી હતી ગમે બે અમારા બે એટલે પુરુષના બે ને સ્ત્રીના બે કે કમ્બાઈન બે હવે તો કોઈ બીજું નથી કરતું તો તમારે એક જ કરવું છે તો એ તો હા પરફેક્ટ કરો એટલે ગવર્નમેન્ટની સ્ટ્રેટેજી છે કે જે આવે તે સ્ટ્રોંગ આવે. Existing health policies and system delivers iron and folic acid supplement. અત્યાર સુધી સરકાર BCCA FEFA જ આપે છે. So now WHO decided to improve their antenatal care with micronutrients. So I will conclude that first 1000 days of life, it is open windows of opportunity to all females. Give them preconceptional micronutrients. Give them as an engagement pill. More than half of the pregnant women have got multiple micronutrient deficiency. We had already proved 5 to 10%. Micronutrients including iron, zinc, iodine, manganese, vitamin B1, B6, B12, C and D and folic acid plays a key role in maternal and fetal development. Evidence, we had already given enough evidence that maternal micronutrient deficiency during pregnancy can lead to development of chronic disease of offspring. Micronutrient supplementation before, during and after pregnancy can help to reduce the adverse outcome and also provide long-term benefit in new life because baby is taking new life. Micronutrient supplementation during pregnancy may help to reduce the risk of preterm birth and low birth weight because gestational weight gain is increasing. WHO has also recommended with UNICEF that UNIMMP, that is multiple macronutrients antenatal preparation as an antenatal multiple macronutrient supplementation for all women free of the cost. So nutrition foundation of life throughout the pregnancy and beyond pregnancy. No period of life is more important than it starts caring for a relatively brief time can lead to a whole lifetime promise. Men need his difficulties because they are necessary to enjoy success, said by APJ Abdul Kalam. And then we had mentioned the dynamic Indian of millennium. Me and Abdul Kalam both are sharing the same award on the same dais by Dr. Muktavassalam in Coimbatore. I am on the GIF of so many dydrogesterone, and your work will be appreciated by so many people if you are doing good work. At the end, everybody should be happy.
जानी चाहिए एक्चुअली कहते हैं the time to be happy is now and the place to be happy is here and the way to be happy is to make someone happy and have a little heaven right here.
Today in Surendranagar we have got convocation of Surendranagar University and we are giving honorary PhD to Sri Sri Ravi Shankar today at this place. As a trustee of that Surendranagar Society, Surendranagar University, today I was supposed to be there, but this commitment was here, so I have not gone over there. Now we will go there and give their duties because we are 4 trustees in Surendranagar University and today we are giving honorary degree as a PhD to Sri Sri Ravi Shankar in Surendranagar. Thank you very much for patient hearing and thanks a lot. I hope that I have not made you sleep. Thank you.
Thank you, Dr.
Any questions? Welcome.
Thank you very much. It
Yes,
was
sir.
very
Yes.
good having you here.
Mike.
Yes.
Yes, sir.
What are the sign symptoms of vitamin D, vitamin deficiency, and then in which cases you give injectable vitamin D?
Binal, this is for you. Vitamin D3 hypervitaminosis. How many symptoms and in which cases you will give injectable?
Normally, like I have had this discussion with the endocrinologist also. Injectable vitamin D should be given if the level is less than 10.
Yeah.
The normal limit is less than, if it is below 30, you will call it deficient, but if it is less than 10, then it is better to give first dose, single dose injectable, and then from next week you can start giving weekly 60k, either liquid or tablet. And the first question.
Hypervitaminosis.
The symptoms of hypervitaminosis D, the most commonly what I have seen clinically in practice is having eruptions on the skin, like pigmentations and eruptions on the face. That is the most common.
Just psoriasis-like thing, pseudo psoriasis, peeling of skin, and there are sometimes leg cramps also. But that vitaminosis will be over by stopping the treatment.
Yeah,
it is a self-limiting disease.
Exactly. So you don't have to do any other treatment, but just tell them that you stop it for a while. So that is the most common side effect which I have seen.
Thank you, Vinay. Any more question?
So what would happen in hyperemesis?
Hyperemesis. You have to use second tablet. Simple. First treat the hyperemesis. Previously in Baroda Society also I had taken the GERD, and in that I told there are 8 different tablets are available. You can use judicially, starting from Meclizine to Granirex to Perinom. This is metoclopramide. Then you can give Finargan, you can give Stemetil. Chemoreceptor trigger zone and sleeping zone both are together. So you give the medicine which is either prokinetic, that will increase the gut motility. Then Yeah.
So I would like to add one
Yeah.
to antiemetic. Clinically, I've seen very good response with ginger
Yeah.
supplements. So gingerol, and especially there is a latest medicine, Doxinate G.
Doxinate G is with ginger
So it is
available.
giving excellent results. And even હું મારા પેશન્ટ્સ ને લાઈક આપણું ઘરગથ્થુ ઉપચારમાં આપણે જે સૂકવેલું આદુ હોય ને
મોઢામાં રાખવાનું.
નાનકડું ટુકડો, not the big, because બહુ વધારે if you keep it for long you might get ulcers and that. So but whenever she is having lot of nausea, તો થોડુંક
Madam, Adu is
આદુ
good. I'm not writing Adu.
હાલા એકલા એકલા ના ખવાય.
આદુ ઇઝ વેરી ગુડ, પણ આદુને આપણે સાથે ની સાથે પ જોડી દીધો છે. આદુ પછી પ સમથિંગ satire, yes. પણ આદુ is very good for digestion, and that is Doxinate G is also available, and you can also improve G. There is no what you call એની પર પેલું નથી, શું કહેવાય, તમે કયું નીકળી કયું જાય, પેટન્ટ. આદુની પેટન્ટ નથી.
It helps in acidity also,
Yeah.
sir.
Yes, madam.
So
I would
regarding
request-
hyperemesis, I remember I called you for that talk, that
Yeah,
was
yeah,
excellent. But what I do in a general practice, as Beenal said, you can make a nibu pani or something and add little bit of adu and ice cube તરીકે એને તમે ફ્રિજમાં મૂકવાનું કહો, let her keep
અને
her in
ચૂસ્યા
the
કરો.
face, ચૂસ્યા કરો, it gives a local anesthesia effect, it hydrates you and also treats you for hyperemesis. That is what I use in the
એના માટે મેડમ સરસ ઉપાય છે. કશું નહીં કરવાનું, વાઇટલ જેટ એચડીઆર પાવડર આવે છે એની અંદર આદુ નાખીને એના ટ્યુબ બનાવી
ટ્યુબ બનાવી દેવાનું, એટલે જે પણ આઈસ
એટલે તમારે વિટામિન સી બી મળે, એનર્જી બી મળે, અને એને જે ઉલટી પુલટી થતી હોય એમાં બહુ જ સારું પડે. ખાલી એને આઈસ ક્યુબ બનાવીને બે પેલા આદુ નાખી દે, બાકી વિટામિન સી ને બધું તો વાઇટલ
બધું
જેટ
છે.
એચડીઆર બધામાં છે. ઓલું તમે લીંબુ ને આદુ સુગર કરવાનું કોણ, કોઈ નથી બનાવતું. અને આ પીલા સીધું તૈયાર માલ. એવો પણ દિવસ
That
આવશે
is what
કે
I'm
મારી
using
પાસે 9 મહિના
practically.
નથી, 3 મહિના બચ્ચું આવે એવું કરતું, એવા દિવસો આવશે.
આઈસ ક્યુબ્સ કે બનાના શેક તમે જમાવીને ખવડાવો, પેશન્ટ ઇઝ એનર્જાઇઝ, શી ઇઝ લેસ હાઇપરેમેટિક એન્ડ યુ ગેટ અ ગુડ રિઝલ્ટ, શી ઇઝ હેપી વિથ યુ એઝ
અને પ્રોટીન પાવડર માં મેડમ જે નથી પ્રોટીન પાવડર ખાતા એને કહેવાનું 4 ચમચી પ્રોટીન પાવડર, અડધો કપ દૂધ, સરસ મજાનું જમાઈ રેફ્રિજરેટર માં મૂકી દો.
આઈસ્ક્રીમ.
તારા ઘરવાળા કે આઈસ્ક્રીમ ખવડાવ.
અચ્છા,
દહીં.
ઘરવાળાને ખવડાવવાનું કહેવાનું મારે નહીં.
ઘરવાળા કહો. તો નહીંતર શું થાય, બીજું તો તમે કરી જશો, પણ તમને બહુ મન થાય કે હું ખવડાવવા જાઉં. બહુ બેટર છે કે એનો ઘરવાળો ખવડાવે.
Sir, Manish bhai, a lighter side of it, nowadays all the mothers has to keep all the prescriptions ready to show it to their future children.
Ah.
That see, I have done
I
this thing.
did. Ah.
Ah.
They bring that back happy.
Don't sue me, don't sue me.
Don't take me lightly. એટલે હવે પ્રેગ્નન્ટના પ્રિસ્ક્રિપ્શન આપણે લેમિનેટ કરાવી દઈશું કે 21 વર્ષ સુધી રાખવા, જે પરદેશમાં રેકોર્ડ 21 વર્ષ સુધી રાખવો પડે છે. મેની મમ્મીએ કહી નહીં, એટલીસ્ટ દવા દુકાનેથી જે બિલ લઈ લેવું કે મેં 1000 દિવસ સુધી ગોળી ખાધી હતી, હવે જે કંઈ થયું તારા પોતાના જેનેટિક્સને કારણે થયું છે, એમાં મારો વાંક નથી, મારી મુઠ્ઠી ખુલ્લી. Thank you, Baroda Society
Madam's
for
comments
giving me
Now I
opportunity. Thank you.
request Dr. Sushma Bakshi to give her expert comment.
Yes, ma'am.
As usual, Manish, I think this was one of the very good talk of yours. And what is more important is that you gave household examples, you gave references, the latest references, and Indian context also, in a very lucid way.
Thank you, madam.
Thank you for that. I think everybody over here knows about that a proper diet is necessary, micronutrient is necessary. થોડી દુર્યોધનની ગતિ જેવું થાય, જાનહામીના ધર્મચર. એટલે આપણે બધાને ખબર છે. I see 4 categories of females in our population as of now. One, who has faulty ideas about the nutrition and the food, and they have abundance. So they prefer fast food and everything, and that's why they are deficient. Second category is that who is ignorant about it. I mean, they don't have faulty ideas, but they don't know from which food the micronutrient is available and what I should prioritize. And they have enough of the things, and that is why they are suffering from deficiency. The third category is they are ignorant and they don't have the things. So both the things which is low, middle, and lower class of the females. And there is fourth category emerging now. They know everything and they have everything, but they don't have time to eat proper things. They are stressed. They don't have time to feed their children. They don't have time to make food at home, and that is why the entire family is suffering from various deficiencies, and that leads to the problems which pregnancy and the children are facing as of now. So I think the job is tough. We, Baroda Gynec Society and Dr. Archana, who has taken up the task, so we all need to treat the kind of categories which we face. Whether we are working in the field, whether we are working in our own OPD, we can make the difference in their lives, and that should be prioritized. Nothing more I have to add into what has been told by Beenal and Dr. Manish, but it is not a problem of only developing countries. I'm telling you. I'll give you a small example which I recently had seen. You will be shocked. I was at Melbourne, and then upon the request of my students who are in Brisbane, Reshmi knows your contemporary, Dr. Rashida and Dr. Sajid. They said that come and visit us. That was the night Sajid was on his emergency duty. Saturday, Sunday we were there. I was shocked. There was a lady, 6th gravida, who had come for the delivery, and throughout the pregnancy period, she had not taken any antenatal care, no tablets, no examination, not even one ultrasound, there is no scope of tetanus toxoid over there, they don't give, and she refused to the doctor for the examination. She said, I want everything natural. I have come here, you just have to deliver me, but I'll deliver naturally, 6th gravida. The doctor requested that at least get your hemoglobin done. She refused to allow the doctor to put hand on the dummy, and hemoglobin was done. It was 7 grams hemoglobin. That much was she allowed. So her cross match and everything was sent, and she said, okay, now I'll be on the labor table. When I deliver, take care of my child. At night again, 11 o'clock, when we were talking, the call came and said that the nurse said that the baby has delivered and is premature, but it's okay. After 20 minutes, she phoned again. Sajid was relaxed that nothing is a problem.
Second baby came out.
So nurse said that probably there is second baby inside. Because she never allowed the examination and ultrasound. So they were all very unhappy, and he rushed, of course, delivered the second child also, and there was retained placenta, and the lady was shifted to the tertiary center because her hemoglobin was low in a helicopter from there for the further care. Can you imagine?
This is happening in Melbourne.
This happened.
In our Koladia Drampura Tetuki, it's okay. But in
So-
Melbourne also this is happening.
I would add a 5th category, the females who are saying, me and my choice. And that also has to be attended. So I think that we look after our females best of the way. We are doing much better. Applause for us. And thank you very much. I'm sure this Sampurna movement of Dr. Sunita is going to go through the entire nation in a great way, and will have a positive dent in the maternal and fetal health. Thank you very much.
Dr. Sunita has got blessings from her Gurudev, and we had already seen her videos every time. In this Sampurna, she talks about this micronutrients, and we have to thank Mayor for unconditional grant. And we had done Arogya Yatra, We had finished 2 Arogya Yatra over there, Tirupati and Rishikesh. In that Yatra, Vinalben, we are doing Know Your Number. And I will request everybody that somebody is talking about the numbers, hemoglobin, BP, weight and sugar. This is aim of Dr. Sunita, that every lady should know their number, like age, hemoglobin, BP, weight and sugar. With that we can prevent so many diseases. Likewise, she had done all the programs for postpartum repression, gestational diabetes, hemoglobin, and we had published 10 books. Those who had attended AICOG, we had given them all these 10 books free. That is EBBR, Evidence-Based Recommendation by FOXI. It is not that we are telling, this is the evidence which is there, and for PPH, for gestational diabetes, for fetal medicine, for preterm labor, for fetal, for this hemoglobin, everything is there to know the evidence base. And I will share the EBBR. You might have got to know your numbers. You don't have to do anything. Everybody has got their patient. Your patient know their hemoglobin. We had already done it. Sugar we are doing. BP we are monitoring. So only 2 parameters that we have to go for laboratory, that is HB and sugar. Weight and BP we are measuring. You have to just scan the QR code, fill the data, and nationwide within 1 year we have got incidence that how many percentage of less hemoglobin are there, how many people are there of hypertension, how many has got diabetes. With simple thing. And notion is know your number. Every lady should know their number of hemoglobin, sugar, weight and BP. And this is the mission of Dr. Sunita, that we have to come out with our Indian data. I am telling all the data of Western countries, 6 to 10%, 5 to 10%. Why not we have got our Indian data? And everybody can contribute. Everybody has got 20, 30 patients in OPD. So every day you can scan 20, 30 forms and it will take 2 minutes. Just name, address. We had also removed Aadhaar card and everything. Name, address. If you
phone number છે sir, phone number
Aadhaar card. Aadhaar card નથી જોતો. Phone number નાખવાનો.
So I'll share. I have already shared and few of my members have it, but I will again reshare because there are multiple projects. Even depression is a very
Depression
good
is
project
there,
which is going
postpartum
on.
depression,
Reshmi has
initial-
done great contributions as she's sitting over here as a part of midlife management committee. She is consistently filling the know your number thing also. And anemia campaign is also there. I'll share the barcodes again. It's very easy. Just put it on your OPD reception. Ask the receptionist to scan. Get your number over there. I mean, your name also to be directly reporting to Dr. Tandurkar madam. So I think this is a very nice campaign and we are all participating. Thank you for bringing that know your number again, Manish bhai, because it's very good.
And National Nutritional Institute of Hyderabad, who is working all over India, has got very good Indian data of ours of each region.
Yeah.
So we can go through
We
their
can
site
we can
and get.
compile that data with ours,
So we
and
can-
our
We are already, I mean, doing very good in that, ma'am. Every Amleen is sharing it with us, and
Amleen.
Priya is a pivotal role. Dr. Priya Gupta is doing a pivotal role. So I think generating our own Indian data is something different this
Something
year,
different.
and within a month, madam, we have got so many data collection.
Every
I would
day we
appeal
are
to everybody to
just
be a
like
part
just
of
like
it.
share bazaar result every day we are.
Every day, every week we have the
Data number.
Exactly, that is a share bazaar number.
But share bazaar is falling down, our data is going up.
Oh.
So madam, in nutshell what we had told, we have to convince our mothers before consummation to do very good care of them. So समझ को समझ के समझो, समझ को समझना भी एक समझ है, समझ के जो ना समझा, मेरी समझ में वो ना समझा. Thank you.
Thank you, Manish bhai, for making it more lively. And chairpersons, Dr. Bakshi, you can introduce Dr. Reshmi for the last talk of the day.
Now I will
Great show.
welcome Dr. Reshmi.